I named this talk "Reading the Hidden Challenges of Making Health Research Reusable," and we started off with Powell talking about the HDRN being about trying to standardize things, and Rachel spoke about, where's my note here? Yeah, Powell talked about standardizing practices. Rachel spoke about the data sharing practices that happen. And then we've had people talk about more about TREs and some more specific things. And I kind of wonder who here has been through the process of asking our NHS Trust for data that was collected in routine care for their research projects. Hands up. There's a few people. Have you guys that put your hands up have to do it more than once? Yeah? Did you find yourselves repeating yourselves, going through the same bureaucratic hurdles over and over again and getting very, very frustrated by the whole thing? So I sort of put this flow together of this is sort of the research process you might go to. You have your research idea. You spend a lot of time before you even get the grant funded. Then you spend time specifying the data, all the things you might need. Then you have the data extraction, approvals for data extraction and transferring, all these complicated things. Before SDEs were a thing, you do your analysis and then you have your output, and you're left over with a data set that is going to be deleted or just applied a retention policy to. And I want to highlight these 3 bits where you might have had to find yourselves creating solutions to particular problems every single time, and it might be slightly different, but you might find yourself working with individuals within the trust or in other organizations where the solution lies with them. And if they change jobs or if they leave, then that particular solution you might have come up with no longer applies, and you have to do the whole thing all over again. And if we're going to have data in secure data environments that is reusable, that can be linked, what we need to do is to find out where those pain points are. And, things that, like I said, threaten timelines and data reuse, and try and come up with a system of collaboration between researchers and secondary care providers to actually, institutionalize these solutions so they don't have to be overcome again and again and again. So the purpose of this session for me is we won't do this today, but I want to start the conversation understanding how you've done, most of you guys over here on this table, how you guys have gotten your data. And it's the stuff that you won't find, the stuff you have to do before you get your information governance signed off. It's all the soft interactions you have with people within the trust. And of course, it can apply to just the easy data, the stuff that's easily coded and extractable, the stuff that might need a bit more transformation, and particularly for my interest, the multimodal data, the images, the vital scans, and that sort of stuff, where it is much more complicated than just a simple push button, get data, have fun. So yeah, which parts of the process for you guys on this table went well and which were lengthy and painful? And for everyone else involved in the this ecosystem of health data research, what do you want to be included with data at the very start of the process? If I go back here, when you're, hang on. Yeah, when people are doing this bit over here, you still have to do if you want to work with a secure data environment. Which bits do you want people to have in mind so at the other end of the process, everything works a lot better? So I have morphs on my slides, so flicking back and forth takes ages. And yeah, this is all for the current project that will feed into something that will hopefully streamline the movement of health data in a secure, safe way to SDEs. And hopefully in the meantime, until those are set up properly, the usual research platforms. So there is another Slido, which is not the one on your tables. So if anyone has any ideas about, when you needed help from people that you didn't quite realize about, Was it in the proposal development, data specification, extraction and transfer? For example, I've been working on a project to do with getting stroke data out of North Bristol Trust, and it all hinges on one person who, it's not their job, but they work in the business intelligence unit for the neuromuscular department, and we just have to hope that she sticks around, because she's the one that designed some SQL queries to sort of generate this thing in the background. And if we want to keep going, we have to just ask her again for more data. Like if we have to change the research question, we have to re-specify to her. And if she moves on, the whole thing collapses. So how do we institutionalize that as a research community, working as academics, as industry people, as research councils with NHS trusts, and for now trying to focus on multimodal data in secondary care. Yeah, also please try and think about the kind of assistance that you needed, whether it was clinical knowledge, whether it's technical knowledge about the systems, whether it's both, when you had to ask a clinical collaborator why a database had this particular field, or something changed, or from like an early part of this data collection period to the next. Organizational knowledge, like who did you not know you needed to ask for help in this whole process going forward? And again, like I said just now, like given that we want to make things more reproducible and dependable for this growing network of research, what things if you think back to when you did this before, what did you wish you knew at the start to sort of design into the system? And if we could just have even a framework of recommended practices for people, just maybe in Bristol and UME, to work with our local NHS trusts, all that stuff would be helpful. And I'm going to try and sort of collate that going forward. Down here, added on Amy's suggestion, is like, if rather than problems you had, who made it easier, if there's any particular people and their roles within the organizations, if you can sort of highlight them, that would be super useful to us going forward. That's the last slide, and is everyone who wants to on the Slido? Yeah? Okay, great. So I'm gonna swap screen and have a look and see what we've got here. So yeah, I've done talking in 10 minutes. So we've got 5 minutes to have a look at anyone who's actually typed on this screen. So where are we? Oh, right, we've got, so just to keep putting things on here, and I'll have a look at them later on. But we've got things like getting a straight answer to what do you need from me? Yeah? Oh, it's not on there. Okay, thank you very much, James. I know how computers work, everybody. There we are. Okay. Right, now I'm in the position of scrolling through things where I can't see it. All this is great stuff. Metadata discoverability. Metadata required perception. More about metadata. I don't know, can you guys upvote things on the Slido if it's particularly important? All that's really good. So yeah, if anyone wants to say anything out loud, because I'm kind of split now. Yes.